the plantar fascia. It's important with all ultrasound evaluations to understand the anatomy of what you're looking at. Think about positioning the patient so that you can dynamically evaluate and move tissues easily and also apply enough pressure. You need to understand the skeletal landmarks as well, in particular the calcaneus. And certainly you need to understand the physics of ultrasound image generation so you can optimize your machine by changing frequency and gain to see this structure really, really well. The central band of the plantar fascia is one of three bands: the central, lateral, and medial. The medial tubercle of the calcaneus is where this central band originates from and then thins out over the deeper position of the flexor, digitorum, brevis muscle, which we'll see in a second. The central band is the thickest and easiest to see. This is what we're going to see on ultrasound. So we're going to see the calcaneus is that bright white bony landmark. The plantar fascia comes through to attach onto it in this long axis view. The FDB sits deep to the plantar fascia, and then the fat pad and subcutaneous layer sit superficially above the structures. This is an example of pathology. A normal plantar fascia measuring less than 4 millimeters in thickness. This is what we're looking for. Significant changes in thickness that are easy to identify. And it's always useful to compare to the contralateral. This is a live scan now of the plantar fascia. We can see the calcaneus nicely, and we can use the windlass mechanism to ensure that we're on the right structure, optimizing our depth to see this image clearly, and then thinking about changing our frequency. So reducing frequency will change our image, enable greater penetration of sound waves, but potentially lose resolution. So this is a lower frequency image here. We can see the plantar fascia very nicely, but we lose a little bit of that resolution. So I'm going to change my frequency back up, and you can see the plantar fascia there nicely onto the calcaneus. Certainly need to be applying a fair bit of probe pressure here as well to get enough echoes down to these structures, and think about that region where you're going to measure. We can look at this dynamically with the windlass mechanism. First, MTP joint extension dynamically tensions that up. Now we can go into short axis, which is a little bit trickier in some ways to see, highlighting that calcaneus, and on top of it you'll see the plantar fascia. Once you've got a really nice clear image, you can palpate the subcutaneous fat layer to try and create an interface to help you see the difference between the tissue layers, between the fat pad and the plantar fascia.